I have post-traumatic stress from serving in the service. And, I need to be in a quiet place without a lot of stress. I chose this as my sanctuary in life.
It is really frustrating to me that after working so hard for over 30 years to build something nice, that it is compromised by the possibility of PFAS chemicals in the well.
Let down, overwhelmed, betrayed, forgotten.
They knew about it even in the 70s. They knew they were doing something they shouldn't do.
To get that letter in the mail 6 months after he passed away, and then to start my research on what PFAS causes: pancreatic cancer, thyroid issues, and then to go back through his history and just think, oh my gosh.
Wife died, cancer. Whether it was related to water, who knows?
It feels like they're ignoring us or pushing us out of their way. What's going on? It's important to us and for our health. Am I doing the right things to keep my family safe?
How many years have we been drinking that water as well as the livestock on the farm here? I worry about my new grandbaby that's here on the farm, my son, his wife. I'm concerned. What are the effects that are so unknown?
I can't bring Larry back and I can't bring my mom back, but hopefully through the stories and all that we're doing that this can stop.
We have to stand up and try to hold our electeds and the agencies accountable to fix this problem. Water's the new gold. And our gold is rotten.
Hello, my name is John Hancock. My neighbors and I organized the West Plains Water Coalition. Our purpose is to understand and educate the community about the threat of PFAS contamination in our groundwater and in our wells. To begin this discussion, we need to understand a bit about the hydrology of the West Plains. Let's meet Dr. Chad Pritchard of Eastern Washington University.
Been working the West Plains for hydrogeology and geology for about the last 12 years. We don't really know a lot about the older rocks around here, but that younger geology is about 16 million year old basalt, flood basalt. So it'd be like Hawaii, the big island of Hawaii with the lava flows flowing everywhere. That's what's really important in the West Plains, especially for groundwater aquifers, are those basalt layers, the lava flows that came out. About 16,000 years ago were the most recent Missoula floods, where we had catastrophic flooding from Montana and possibly from Canada as well, rushing to our area into the Columbia River Valley and scouring out all of eastern Washington. The amount of erosion that just took away material, forming valleys and coulees, and then all of a sudden at the very end of it was that deposition of sand and gravel. So when you start talking about how water works in the geology, that basalt, the water flows very slowly. Whereas in the sand and gravel, the water can flow much faster through the ground. And so there's kind of these two different, a dichotomy of aquifers in our area, which makes it really fascinating to work with.
The West Plains are high ground above the Spokane River and the Spokane Valley Rathdrum Prairie Aquifer, from which the city of Spokane gets its water. Up here, water is scarce. It's underground in our own little aquifer, around 120 square miles. Thousands of residents depend on water from 1,400 private wells that tap into this aquifer. Unlike people on regulated, carefully monitored city water systems, no government agency protects these wells. We are on our own.
People sitting up on top and drinking water from the West Plains is that they encounter that sand and gravel. So they'll go through a couple different layers of basalt, and then in that basalt there's these incised portions of sand and gravel, what we call paleo channels in the West Plains. Some wells are going to be shorter that go to one basalt flow, one aquifer, and others would be deeper that go to a different aquifer, and some might even be in some of that paleo channel deposit. And so different wells access different aquifers, and then those different aquifers are actually polluted or contaminated in different ways as well. So it depends on where you are from the source and the groundwater flow path, if your well would be contaminated. On top of that, we also have a huge amount of erosion from the Missoula floods that gives you very isolated channels that allow water to go a lot faster and be communicated to different locations.
In 1967, a fire killed 134 sailors on an aircraft carrier off the coast of Vietnam. The U.S. Navy searched for a solution, something to quickly extinguish even the hottest jet fuel fires. The 3M company answered with a new product that surpassed all expectations: aqueous film-forming foam. The foam's magic ingredients were a new family of synthetic chemicals called per- and polyfluoroalkyl substances, or PFAS, PFAS. Fireproof, waterproof, indestructible, with an endless storage life, PFAS seemed perfect for the task. 3M's ads even said the foam was biodegradable, low in toxicity, and harmless to animals. PFAS chemicals began to be used in hundreds of products beyond firefighting foam. They became non-stick cookware, waterproof clothing, carpets, packaging, even cosmetics. But the PFAS manufacturers actually knew from the beginning that these chemicals are not harmless. In fact, they are incredibly toxic, many times more toxic than well-known poisons like arsenic and DDT. They just don't kill right away. They cause diseases that take time to show up: cancer, liver disease, heart disease, pregnancy complications, thyroid disorders, infertility, and many others. Now, 3M and DuPont are facing huge class action lawsuits. Most state governments are suing as well, with claims expected in the hundreds of billions of dollars. As the chemical companies knew long ago, the health effects of ingesting PFAS are profound.
PFAS has been known in this area for a number of years. I became aware of it when I was the local health officer back in 2017, 2018. There's thousands of PFAS, so we use this as sort of a generic term for 14,000 different chemicals that are just minorly changed. And as you now know, they're called the forever chemicals because they break down very slowly in a lifetime, if not longer. People are exposed to those substances, and it can be, again, one time, it can be 100 times, it can be 1,000 times. Commonly, people are exposed to them through drinking water. We talk about PFAS bioaccumulating. It means it doesn't go away. It breaks down or it's excreted by the body. The longer your body is exposed to a toxin, the greater the likelihood that you will have an adverse outcome.
A friend of mine that lives north of me was in the Fairchild testing area, and his well tested positive for PFAS chemicals. And so I started to pay more attention to everything that I heard. I learned that there was a blood test available for PFAS levels in your blood. They tested for 16 PFAS chemicals. I tested higher than the national average on 6 of those 16 chemicals. And for me to have higher than the national average levels of those 2 chemicals pretty much convinces me that I have been subjected to firefighting foam chemicals in my well water.
PFAS, as well as many other chemicals, are what are called endocrine disruptors. So they disrupt the endocrine system. This system produces hormones, and hormones work in very small quantities to create big effects. So where some of the science shows it to be an endocrine disruptor is in the thyroid gland. The thyroid gland is a small gland in your throat, and it's involved with metabolism. And if it is not functioning properly, it can affect metabolism, which affects everything that we do. And we've seen, again, with PFAS exposure, that people's cholesterol levels have been impacted. And the thought is that it is impacting the liver.
I have cholesterol of 318. I practice yoga daily. I'm a vegetarian. Why do I have 318 cholesterol?
We're concerned about fetal development. There seems to be impacts on fetal development and infant development. If I look at adults, then we're seeing that there seems to be fairly strong associations between people and kidney cancer, renal cancer, and testicular cancer.
Didn't find out about it until 6 months after my husband passed away. He had a gallbladder issue, and through his surgery and for his gallbladders, when they found stage 4 terminal pancreatic cancer, went to the oncologist, and the oncologist gave us about 90 days, and he lived 67 days. 6 months after my husband passed away, I received a letter in the mail that said the Air Force wanted to come and test my water.
In 2015, a career firefighter at Seattle's SeaTac Airport died of cancer, becoming the first proven occupational PFAS death in Washington. Those SeaTac firefighters trained only twice a year, but at Fairchild Air Force Base, it was 2 or 3 times a month for more than 40 years. For decades now, both military bases and civilian airports have been required by federal law to perform frequent fire drills with huge volumes of firefighting foam, sometimes filling whole hangars with foams, covering whole runways. After the training, the foam is simply rinsed away from the runway, off the trucks, out of the hangars, and into the sandy ground of Spokane's West Plains.
Yeah, my brother and I were demolition contractors. We did a lot of work at Fairchild, and that was one of the main reasons we moved to our location. We've never drank the water. We cooked with it, but we never drank it. And that was on the advice of both my father and my wife's father, who were both in the military, both stationed at Fairchild at one point in time. They both said that there's a lot of nasties that were dumped off the end of the runway for years and years and years when they were in the service.
Ever since my parents moved out here in 1939, there's been livestock on the farm here, cows specifically. Last May, we did a well test here on the farm. It came back positive. We're upwards of close to 300 parts per trillion, where the safe level for Washington State is 10 to 15 parts per trillion of PFAS and PFOA in the water. We immediately switched to bottled water and have since installed a system, but that does nothing for the outside, the grass, the livestock, the pets. There's a large area of property on the West Plains that is affected.
It's farmland. It's rural traditional. People here have cows. My neighbors have beautiful horses, chickens and pigs and goats and llamas, and they all drink the water. My neighbors grow beautiful gardens and give me peppers and corn, and being a vegetarian, I can't wait every year to have all this wonderful fruit. They water their gardens with this water.
A fellow down the road sold his place. And I said, "Oh, you're leaving?" He goes, "Yes." He said, "Because of the water situation." I says, "Well, do you have the..." He says, "No, I don't trust it coming down to my house. So I'm selling it and getting out before I have a problem." So that's my biggest problem. You know, will it put my cost of my land down a lot? Or will I be able to sell it?
I think the property overall in the whole canyon, in the whole area, I think, yeah, it definitely affects the property value. You know, and I've heard neighbors talk about it.
If I wanted to sell, especially if a family wants to move out here with children, would they want to trust the filter system when this could cause severe medical problems?
It worries me a lot because I think that if we were to ever try to sell, that would have to be something that would have to be upfront right away to someone who's going to buy it. They would have to be willing to buy their own water or take a chance and drink it. I mean, but they would have to know before we could sell this property.
There's nothing in any requirements for the U.S. Department of Agriculture today that even recognizes PFAS, PFOA as a situation on farms to have to disclose it.
In 2017, Fairchild admitted its PFAS contamination of wells that supply the city of Airway Heights. It launched a program to test nearby homeowner wells and has now installed around 100 whole house filter systems in toxic wells it discovered. But there has been no help outside that nearby area that Fairchild chose to test.
Fairchild Air Force Base sort of put a boundary to what they considered their contamination at Hayford Road, and that goes along with one of these old paleo channels. Unfortunately, when we started looking at the three-dimensionality of the paleo channels, just north of there is actually like an old waterfall. As Missoula floods came through, it scoured out a big hole in the basalt. So that's actually a place where your groundwater from the surface can actually communicate with lower aquifers as well. And we do find contamination in the lower aquifers to the east of that Hayford Road as well.
Our concerns grew last year when the State Department of Ecology found Spokane International Airport responsible for PFAS contamination in its groundwater. The Environmental Protection Agency has begun working with state and local agencies to address private well concerns across more of the West Plains. But the Fairchild cleanup hasn't even started, and the Spokane Airport investigation is barely underway. Neighbors and governments are now paying very close attention.
Companies have known about the toxicity of PFAS. The federal government should be more proactive in ensuring that these substances are not released into the community and into the environment.
I would like to see the airport and the Air Force treat this like a community problem instead of like an engineering issue.
What are we supposed to do? Living out in the country, you have to have water. You know, a lot of people have horses and livestock. What are they supposed to do?
The more people talk to the regulators, the more people talk to their representatives, the more people talk to everybody around them, the more knowledge there is and the more need is communicated, the more help you'll get. And it's definitely happening in the West Plains.
The heartache that I hear from the people who were brave enough to stand up and talk about it, that was amazing, and it let me know that I'm not alone.
People like the West Plains Water Coalition, Friends of the Palisades, putting in public records requests or FOIA requests, emailing and contacting their representatives has made a difference. It's huge.
We have a long way to go in this quest for safe, clean water. There is much left to do. I hope you'll join us. For the West Plains Water Coalition, I'm John Hancock.
Hello, everyone. Hi, everybody, and thanks for coming. John Hancock is my name. I'm the president of the board of the West Plains Water Coalition, and it's a pleasure to have you here tonight. A nearby neighbor of mine was devastated by the sudden death of her husband to pancreatic cancer. In a conversation on the gravel road that links our rural homes, she asked for advice about the home filter system offered by the Air Force after they tested her drinking water. Fairchild Air Force Base is 7 miles away. Who could imagine such trouble? Thus began a big new project by a tiny new organization. This survey tonight asks the question, anyone else? The PFAS survey was created by our own health committee, led by Gail O'Neill and others, aided by the Oregon Public Health Institute and Toxic Free Future. We're grateful also to the hundreds of people willing to talk with us and with each other about PFAS, and the growing number of agencies and organizations learning to listen. This event is funded by the Public Participation Program of the Washington State Department of Ecology, but not necessarily endorsed by the agency. This survey was not designed to prove whether PFAS causes cancer. That link was established by scientists at 3M and DuPont in both animals and employees 50 years ago. The survey is about knowledge of PFAS. For 2 years, the coalition has been gathering stories. Now we have a helpful summary of their experiences. The closer we look at PFAS details, the clearer the problem. Gail's committee isn't finished yet with the whole analysis. We'll soon publish the full technical details on our website and linked to other organizations and PFAS agencies. We're recording and streaming this meeting tonight online because PFAS is a concern all across the U.S. in thousands of neighborhoods just like ours. Your presence here tonight and your support for each other is a model I'm proud of. We can't thank the participants directly because we don't know your names. We know some of you are here, and we hope you'll continue to share this story with people you know. You can help again with your continued participation, your storytelling to people you know, your involvement as a volunteer, and your financial gifts to support the work. We've saved time for your questions after the presentation. The blue card gives a chance for you to write a question if you prefer not to speak. And on the back, give us a little of your story, and we'll follow up directly for more information. So if you've got a blue card with a question, Monica will take the cards. That's Monica. Welcome, Monica. On the back of the blue card, there's a chance to write a little bit of your story, and we'll follow up directly for more information. In the interest of time tonight, we ask for questions about the survey. Be brief, please, so everyone gets a turn. I'm happy now for you to meet Dr. Gail O'Neill. She was a registered nurse for 44 years with over 32 years of active clinical practice and 20 years of teaching nursing students in WSU undergraduate and graduate programs. Gail's interests in environmental health and working with people to reduce exposures have become personal because she's lived here on the West Plains for 28 years over in this neighborhood. That's where Gail lives. And she has PFAS in her own drinking water for a long time. Welcome, Gail.
Thank you. Thank you very much. So, who we are, the names of the individuals that are making up the Health Committee are here. Myself, Bob Lutz, Liz Goodwin, Reed Oakes, and Laura Flanagan. Together, some of us live here on the West Plains. Others are very interested in this particular problem based on their public health backgrounds. We decided that we would try to do a survey based on, as John said, some of the stories we've been hearing. We are looking at that as the foci here, in health, access to clean water, access to health care, knowledge about the situation and your lived experience. Of course, we know what the background is. That's what the video is about. We know that there's firefighting foam from both the Air Force Base and the International Airport that have gone into our aquifers and contaminated our water. So there's more information on the website if this is new to you, but I'm just going to briefly start into this presentation now. The survey started end of October, early November, and then it ended at the end of January. So we had 3 months of data that we were looking at. Again, the why, we had several purposes, and one was just trying to get some answers and of your lived experience, and then some of those questions were designed to help educate along with asking the question. So it might have triggered something for you to look up. The committee worked for 3 months on developing the questions, and we went back and forth. We had many meetings, worked with the Oregon Public Health Institute staff to develop these questions. We purposely did not ask certain types of questions because we know that a rural population is different than an urban population. They like to protect their privacy. They don't want to answer certain types of questions, so we tried to make it as open and easy to do, which again, one of the things that we asked or that we said was that you did not have to answer every question, so you could choose which questions you wanted to answer. We did ask 28 questions on 4 subject areas. Again, you can see these here. We had a total of 117 residents who did participate and finished the survey. So the first area is on PFAS literacy. So literacy is basically defined as a way that people know how to read, write, speak, and understand different types of information. And there's different types of literacy. So you might hear of health literacy, for example, if you understand what your medical provider is talking to you about, or what the directions are when you're given a piece of paper when you leave, and able to understand what that means. There's financial literacy, so how to write a check, how to talk to your banker, how to understand the difference between a checking account and a savings account. Well, in this case, we're talking about PFAS literacy, so literacy about PFAS information. Again, as you can see on this particular slide, you can see that the level of knowledge that people started to understand that there was a problem here. The highest level there is in 2024. That's the big green line that's going up. And that was in correlation with the coalition really getting started and putting out those messages and getting into the media so that people started to understand a little bit. The one on the end there, the 2025, that person submitted his survey, his or her survey, on January 15th, so towards the end. So there was at least one in year 2025. So at least we know that it's still reaching people. So PFAS literacy, again, we are wanting to really understand what this is. This is just a percentage. There was 112 responses on this particular area of, do you know if your well has been impacted? So again, we had 68% of our participants knew that they had some kind of problem with their drinking water. On this particular one is what kind of confidence do you have in your knowledge of PFAS? So towards the end there, they had no, on the very bottom, no knowledge, and that was just a very few amount. Most of the people that answered this question were pretty confident that they knew at least enough about PFAS to be able to say that they were very confident. And that means to me that probably a lot of these people that did take the survey are also have been attending some of these coalition meetings. We can't say for sure, but it seems like based on a lot of the other responses that we got through there, that again, these were people that are really interested in knowing what's going on with their water. So the second area was water quality. On here, you can see that we're asking what the main source of their water is at this point. So we have people that are on the very end over on this side, the 6 on the low end, were municipal water users. And out of those 6 municipal water users, 4 are still, were getting water from their municipal source before 2017. And what that means is they might have been getting municipal water, but they still may be at risk for exposures to PFAS, because if that was Airway Heights water, they were drinking it, and it's unknown how long those contaminants were in the water. The highest number are still, at 42, are still unfiltered water, unfiltered wells. And then the next 2 are wells. Either the whole well system is filtered or their house, they have a house system with filtered. The very end is 9 people said other, but they did not give us any responses to what other meant. So, back, go fast. All right, the Hayford Road kind of is that one where you see Airway Heights, the really dark line there. We asked if you lived east or west, and west won. So the number of people, 68 people out of this that answered this particular question lived west of the Hayford line that the Air Force drew. As far as this particular question, we were asking, these 3 kind of went together. Did you test your well for PFAS? Do you know that you have PFAS in it? And do you know what your well depth is? So you can see where there were 111 for those first two, and 114 people answered the last question. What do you know the depth of your well? What was nice is that 80 people did know the depth of their well. And the range that they reported were between 40 feet to 1,250 feet. So it kind of goes from pretty surface water to really deep. The people that were aware of the test results, that particular group of people, 84 of that 111 knew that they had PFAS in their water. Okay, habits and behaviors. This slide is a little busy, and you're going to see that there might be different levels, if you can see the levels on this particular slide with different respondent numbers. And part of that is because they could or could not, or did not have to answer certain questions. So some of the people answered one, some of the people answered two, and some of the people answered all three. So that accounts for the different counts on these particular slides. But basically what this means is, starting at the top, where you have the big pie chart that has the two things, is that we asked whether you'd added any kind of filter system, be it bottled water or a house filter system or a well filter system, to your water source. 48% said yes, but 52% said no. And the question that we were all asking after we saw that was, what is preventing those 52% of these individuals that answered this from getting some kind of a filter system so that they could get clean water? That's kind of a question that just is lingering there in everybody's minds. The second one with the various colors in that pie chart are, what type of system are you using? So again, there's an under the sink system, there's a whole house system, a whole well system, or the drinking water, which is the gray or the yellow area right there. So going from that, we go over to the actual table that said, where are you getting your water from? The highest number there, 39 people out of the 72 that reported it, are buying water. So they've missed that one window of opportunity where they were being able to get water when they'd signed up. And so they're still buying water now. So that is kind of concerning as well. Again, with this particular question, we're now going into some of the things that we're all doing. One of the reasons that a lot of us are out in the rural area is because we want to be self-sufficient. We want to raise our own foods, our own livestock, eggs, chickens, cattle, sheep, goats. We really enjoy having those animals. We enjoy the work around it. So this particular question asked about well water use for your garden or livestock. And are you still using your well water for your gardening or livestock? 79% said yes. The bottom number, or the bottom question there, number 13, have you made any changes to your water for the use of your garden or livestock? And 77% said no. So we know that a number of people are still using, out of the people that answered this particular question, 114, they are still using their well water for animal or garden use. However, there is, the next slide that I'm going to show you is really telling. This reflects the statements that people made, because one of that last question we asked, what types of changes, or can you explain any changes that you made or did not make? And this was really reflecting the grief, the sadness, the anguish that many people had about the loss of being able to do those activities that are really important to them. Growing a garden, raising livestock, having that ability to do so. This was very powerful. Somebody said, I no longer have a vegetable garden or any livestock, goats, alpacas, or chickens. I've just stopped gardening. I've been overwatering with clean water to try to dilute the contamination. I'm relying on the grocery store to prevent further harm to our family. There were a few positive responses. I've put filters on the frost-free to water outside animals. I'm using water from home for animals. I've added a hose filter. Even though those are positive responses, it means that they're having to take extra monies to buy those filters. Bringing water from home to water animals it can be exhausting, and it's also time-consuming. So a lot of these things, these issues, really spoke to the people's feelings about this contaminated water that's affecting all of us. Okay, 14 and 15 kind of went together also. Are you consuming food products that you grow or raise with well water from your neighbors? 112 people answered that one. Yes, they are still consuming products. 48 said no. Out of the 113 that said, do you tend to sell food or products that you've grown? 6 said yes, but the majority said no. There's just for their home use. However, we've got to say, if 6 of these respondents are selling their products, do they know what their well water contains? So that's another question. And then we're going to pets. There's a lot of pets out here. So are your pets drinking your well water? 76 said yes, 33 said no. I wanted to let you know that the American Veterinarian Medical Association reports that there's a study now ongoing at Michigan State University about PFAS effects in pets. Changes have been reported in kidney and liver function in dogs and cats, as well as obesity, respiratory effusion, and hypothyroidism, especially in cats. They are starting to see deaths from animals with pets. And one of the things they're proposing is that if they can find cheap tests for the pets might be the indicator that the family is also got problems. So the fact that if they can test a pet more easily and cheaply, that's what they're working on, that it might be your indicator that you too have exposures and need to take care of your own health. Okay, health effects. This is concerning the level of your drinking water, of PFAS in your drinking water. Are you concerned? And that very nice high column on the end is extremely. There were 8 people that either were not concerned or slightly concerned. We didn't ask why or how or what is the concern, but we do know that there's a number of people that are not, and perhaps they just don't know what their well water is containing yet. So again, it looks like they've really gotten the knowledge here, and that there's an awareness that we've got a problem, and that concern is at a high level. So how many people discuss PFAS contamination with a medical provider? Out of the 114 that reported, only 38 have. So that's very few people for having an exposure to PFAS. And so our question as the committee is the why question. That's something that we're hoping to take forward later on. The next one is about the physicians and seeing your medical provider. How did your medical provider have any kind of awareness to PFAS? This slide in particular kind of shows that there was very poor awareness. Those are those 2 long lines down on the bottom, or the 3 long, that they were either very poor, or just average in knowledge, meaning we don't know kind of what average is, but the poor or the very poor were really telling that the providers really don't know about PFAS. And I've had that experience myself, where I've gone in and talked to providers. I actually gave one provider for another particular person who was having difficulty trying to get their provider to understand. I brought in some clinical guidelines, and as soon as I left, they went into the garbage can, as I was told. So, yeah. So we've got a little work to do here. So the next slide if I can get it to go, there you go, is how were they treated? 29% thought that they were treated poorly or very poorly. The rest there were treated average or up to excellent. And on this next slide, one of the reasons that those same people that reported that their providers treated them good or excellent is because of those providers, and these were the examples of their comments, that their providers, even if they weren't aware of something, worked with that particular person to find out more about it, or worked with them to see if they couldn't get the insurance company to cover the blood test, or worked on finding out information just so that they got their own knowledge. And that's what we're hoping that we might be able to improve upcoming with our health committee. All right, and this particular instance, we had, have you or your family had a blood test? 7% out of the people that responded said, yes, we did. But 93% did not. This little reminder here with the finger sticking up or the blood vial is that you don't necessarily have to have a full blood test where they are now pulling blood out of your arm. There are some blood tests now that are 99% as good as a blood test from your arm that are online that you can order, do yourself. It's a finger stick, and then you send it in. If it comes back where it's positive or a high rate, you can take those particular results in to your provider. What is unknown is if insurance will cover those particular tests. Some insurances will cover the test in your doctor's office. There are several online sources to get these, and if you have any questions, I'll be happy to give you those names of where you can get those. They are, unfortunately, these blood tests are still somewhat expensive, but one goes for, it tests only 8 of the PFAS, but they're the 8 most common. It's about $150, and the other one tests all 16 for about $79. So if you're interested, I can give you that information. These particular questions also go to the 12 people that said that yes, they'd gotten a blood test. So the first column there is were the results higher than normal. Out of the 12, 10 reported that they had higher above normal levels. The next one was, as a result of these tests, did they order any extra blood tests? Even though they had higher than normal levels, only 2 had extra types of tests to do some screening for some of the problems that we know PFAS can cause, such as high cholesterol or thyroid problems. And then the last one is, did you experience barriers getting the blood test? 4 people said yes, 8 people said no. The 4 people that said yes had some comments such as, again, they were rating their physician poorly in both awareness and in treatment, and the physicians just did not listen to them or even did not seem to want to know. And it was, one person basically said that they thought that the doctor wanted to kind of brush them out of the office. So. Immunocompromised. Immunocompromised is a big concern. One is it's reported that your system is immunocompromised through PFAS and that vaccines then don't work as well. But again, if any of you heard Dr. Lutz talk about what happens with the endocrine system, which also operates your immune system as part of your immune system with the hormones that they put out, et cetera, your immune system, as it starts to decrease, allows other types of health problems to exist. So that's why we were asking this particular question. It's a question asked by the EPA surveys and other surveys wanting to know if you considered that you or any of your family members were considered immunocompromised. What's really interesting, as you see on the bottom, the national average, according to the CDC National Health Interview Study, is only 6.6%. Our respondents reported a 33% level. Now, this particular question did not ask if you had these particular these concerns about these different health conditions, but it does ask if you are concerned and what types of concerns are there for the different types of cancers or other problems that we know are strongly associated with PFAS now. The committee looked at not only the information and the research in the United States, but we also looked at the same ongoing types of studies that are being done in Europe throughout the different countries. And there's a consistent list in both areas. So there's testicular cancer, kidney cancer, prostate cancer, the liver enzymes and leading to liver disease, decreased fertility. We have increased blood pressure in pregnant women, changes to the body's immune system, increased or risk of obesity. We have thyroid disease, and then the last level there, which is a 15% level, is decreased infant and fetal growth and development. Now, everybody was able to have multiple responses, so these are the counts of the responses. But we also had a follow-up question that is not on this slide asking, are there any other concerns that you want to list? And some of those concerns included Parkinson's, lymphocytic leukemia, breast, ovarian, and cervical cancers, a brain tumor, hypertension, acid reflux, and gut health. And one person reported brain cancer in their pet dog. So now we're on to the demographics. We didn't ask a lot of characteristics, again, trying to protect confidentiality and anonymity in people, but we did want to know how long people have lived here and then how many people were in the households. So here we have 97 people who responded, and we have a range of 6 months to 71 years in this particular slide, and the average was 21 years of living in the West Plains, and the median, which is kind of the middle there, is 16 years. This particular question is asking how many people in the household. 109 people did respond. It's mostly that big long line is mostly it's a two-person household. There was one report way on the very top of that said 2 to 3 people live in the home. So we can guess that it's probably a part-time resident, something like a college student who comes home for a part of the year and then maybe leaves, something in that order. Now one of the last questions here is the ages of the household. And so you've got from, we had 6 months was the youngest, and the oldest was, again, in the 90-year-old age, so that's that last column. You can see that that's 65 years and up. 95 people reported that age group. I think one of the things that we were surprised at is that there were 45 children or youth less than 18 years old in this survey. So it's indicating that there are some young families here that have moved, and there are young people. There were several babies, for example, that were in the less than 1 year age. If they're on contaminated well water, we've got to be concerned about their growth and development. And so we need to be figuring out what we can do with that particular age group also. So what we learned, the majority of the respondents, you all, 97% are aware of the PFAS. Many have had their wells tested, 76%. 48% have added filtered water to their water sources. A number of respondents have not changed their watering habits for livestock or gardens. And there's great concerns over the health impacts, many of those being cancer. Yet there still was a proportion of people that were concerned for young moms, pregnant moms, and fetal and child development and growth. And that was good to see, because we need to keep remind ourselves that there is that population. Maybe not yet, but it's growing. And we need to be able to focus on that area too. 33% have discussed exposures with their health provider, and only 11% have had blood tests. And again, as I said, there are 45 individuals 18 or under. We need to find out more about the barriers to filtered drinking water and to getting those filters, and also to getting blood tests as a health screening. So you hear all the time, especially women here in the audience, get your mammogram, get yourself tested for cholesterol. Well, a blood screening for PFAS is in that same kind of screening. If you know you've had an exposure, you should probably be getting a blood test to know where that level is. And based on that level, then a provider can decide what needs to happen going forward. There is a chart from CDC that shows what the normal levels at this time that they know of should be. So many people have PFAS in their system already, but there is a level at which it starts to become very concerning. If it's below that level, it's basically called treatment as usual. In other words, if you're going in every year for an exam, you go ahead and they will probably repeat that blood test to make sure it's either stable or going down. But if it's higher, they are going to start saying, maybe we need to add this test. Maybe we need to do a lipid profile for cholesterol. Maybe we need to do a thyroid profile. Maybe we need to look at your liver and your kidneys. So there are things out there for clinicians, and we can, those resources are available to you. We can get anything that you need, and we can also assist you with your providers if you're wanting to get that blood test. But we need to get people to start taking care of their health, being their own advocates, really trying to avoid some of these potential problems. The good thing is, if you get clean water and you avoid some of the exposures, other types of exposures, those levels will start going down. There is good news for pets. Animals have a different type of physiology that if you get them on, if you're giving unfiltered water right now to your pets, they will shortly clear it. They will clear it very, very quickly in their systems as compared to human beings. So if you can get them onto some clean water right away, you're eliminating some of the problems that those pets may have as well. There are, one of the positive comments, or a couple of them, referred to faucet filters or hose filters. Those are available. Most of them were developed for RV camping and the RVs, but they still, there are several brands out there that are tested and certified for PFAS right now, as are other filters. So you can put those, just screw them on to, if you've got a faucet or a hose, screw them on and it will deliver filtered water. The problem being is that you do have to buy them, and they only last 3 to 6 months depending on the size of the filter. But they are available for those of you who might want to continue to garden and know that you're using some clean water. So my next one is limitations of this study. Again, we didn't ask some of the characteristics on purpose. The study invitation didn't have a really wide distribution because we were really advertising it in the West Plains Water Coalition website, and we were really looking at the geographic area where the immediate test areas were known to have contamination. We had one small computer software glitch, so one question, which is why you have the blue cards there, or what else would you like us to know, or what other concerns do you have that we can start to address? And if you want to share your story, let us know how to reach out to you on those blue cards, because we will make an appointment with you and talk about it. We can use that story again to further more information and help us figure out what we need to do for the community. So please use those blue cards and write your concerns and suggestions. So questions? Thank you very much.
Marcy is roving with a microphone, and if you'd like to come up and speak into the microphone here in the front, that's Monica. So put your hand up if you've got a question or hand a card.
Yes. Are the survey results available on your website?
They will be soon.
Yeah.
The committee's still working on this,
Yeah.
and you'll all get a message. Here it is. We hope you'll tune in and watch it.
We're also developing a more technical report that will be much longer and written, and that's going to be completed within the next couple of weeks. So.
I have one question from the audience here, and it asks, can PFAS be absorbed through the skin while showering?
Well, they used to say not really, but there is some new research showing that in some situations, yes. Not much, not well.
I was just going to say that study was on lotions that are put on your skin for 24 hours.
Right.
So it creates a barrier and pushes it into your skin. Water, if you during
Just,
bathing, because you're not bathing for 24 hours.
or washing your face, yeah, exactly. It's generally okay.
She asked, what about hot tubs?
Hot tubs, well, it depends on the type of water you're putting in there. And did you know that you can buy a filter for the hose to take that stuff out of the hot tub? So I would say soaking in a hot tub, and especially if you have some open sores, like scratch or something where that can open up, yeah, you're going to probably get the PFAS in the water into your system. I highly suggest if you have a hot tub, find those filters. They last a long time because you only have to fill your tub so many times during the year or just a little bit, and they will last you at least a whole year for $20. So.
What about a bathtub?
So what about a bathtub? It's the same thing. Yeah, same thing.
Less than 24 hours, you're okay.
Yep. Yeah, you're not sitting in the water forever and ever.
So my question is, what's the advantage of sharing my blood test with my doc, which I did, because I do have high levels. When her response was, well, there's no treatment anyway, so there's nothing I can do. So
I'm glad that you asked that question.
Oh, good.
Yeah, right. That's what they used to say before they had mammograms. There's nothing we can do. Oh, you know, we find a big lump, but by the time the lump is found, it's like you can feel it. So that is going to change. Everything that I said here today about certain things, as science continues to find more information about PFAS, as the levels, like I said, that right now there's this sheet here that was put out by the National Academies of Science about what levels are safe, or when should providers start doing some screening. They're going to probably change, and they're probably going to lower. Just like the EPA lowered the levels, you're going to probably see different information coming out. That is a physician who doesn't know that there's information out there for clinicians. And so again, being an advocate for yourself, you can say, well, why don't you talk to the health committee at the coalition? But that's one of our projects. That's something that we know that now. I mean, it's clear as mud, basically, that there's just not enough information out there for the providers, and we don't have a local resource, which could be the health department, to give that information and provide that training or information to the providers. So we can help you with that. But again, there's having been in healthcare for as many years as I've been, there are physicians that just don't want to go the extra length. Sorry.
Gail, can I try to answer? You may have been the first of that person's patients, but you won't be the last. So you've helped the next person in line.
That's good.
Because if that doctor starts to hear the same question, they're likely to wake up and say, there may be something here. Or they might bring it up in a staff meeting to say, hey, this lady asked me about something I didn't know. Anybody else experiencing that? So the curiosity, and whenever you put your hand up, you help people to come. And that's a good thing. That's community.
That's exactly right. Yeah, exactly. That's, yeah.
Gail, I had a question. I delivered a water filter to a residence last week, and the gentleman said he requested a blood test, and he's a veteran, and the veterans hospital told him they will not do a PFAS blood test, and he did not know what to do, and I wasn't sure what to say.
That's really interesting because the Department of Defense itself is being sued by a number of military who were firefighters, one including my brother who was in the Navy. And so there's a lawsuit, but there's also the VA across the United States, especially knowing this, it sounds like, again, a lack of communication because they're getting blood tests across the nation. So if that's happening, then the VA here needs to get some more information. I don't know who to contact there, but we obviously need to find some kind of resource we can put on our website about the VA and how they contact.
Can I add to that?
Yeah.
So I'm retired Air Force.
Good.
And I did not go to the VA hospital. I went out to Fairchild and saw my doc out there, and he gave me the PFAS test. So if
Would you write down that doctor's name on that blue card?
he's not here anymore.
Yeah, that's the problem with
Fairchild.
military.
He was the only doc out there.
And he said no problem, and he did it for me. I got my results back, and they were terrible.
Yeah.
But they did do it out at Fairchild.
And then mine, I told the doc, I understand it has to do with the coding, sorry.
Yeah.
Because I had heard that here at a meeting with people having, so it went back and forth, but TRICARE ended up paying for mine.
Right. So the military is very aware. If a veteran is not getting that information, I mean, it's like I said, it's got to be a miscommunication because there's a lot out there and somebody isn't looking at it within that system.
You'll see in the lobby on that big table a lot of paperwork literature. Some of it is about how to talk to your doctor, how to read blood tests, all that. So take your time as you go home to pick up some information out there that corresponds with what you'd like to know.
I want to thank you, Gail, for all of the work and for everybody who's done the work here for this. I hope that you'll put online where we can get the little prick test for our fingers. The reason I wanted to say something is that our legislators in our state, in the 6th District, are going to be holding a telephone town hall on Tuesday, April the 1st, and their time would be 6:30 to 7:30, and you can call 509-214-0588 as the call-in number. And I'm saying this because I want it to go on video, and I want you guys to all contact your legislators, who is Holly, Graham, and Volt, and let them know in the 6th District what's going on and that they need to be representing us here.
That's right.
So that's all I had to say. Oh, yeah, okay, the number again is 509-214-0588. And it will be April 1st, so it's 6:30 to 7:30.
I got a card in the mail today that had that information in it. So look in your mailbox, you may get the information directly.
Hello, everybody, and thank you again for doing all of this work. I have a few questions that I hope can be addressed. One is one of your slides, you had a pie chart, and there were a certain number of people who had whole house filtration. So I'd like you to define whole house. Is it interior, full interior, plus full exterior? What do you refer to when you say
When it
whole
said
house?
whole house, that's how they reported it. So usually with a whole house system, it is all of your drinking water areas. Usually your faucets that, some people will define it as the faucets where you get your drinking water, so your kitchen, your bathrooms, and your tubs and showers. That would be a whole house. Your under the sink would be just the one that would be specific for that particular sink.
So I'm wondering, does whole house include exterior?
No.
So we're talking
No.
about exterior.
No, it does not.
Okay.
That one I can answer
So
easily.
interior only.
Yeah. Well, that's true, but most of your filter folks will say that if you're putting it in the house, you're putting it to the pipe that goes directly to the house. You can ask to have it exterior.
There are about 100 homes that have gotten a whole house filter system from the Air Force.
Right.
That
And
is the
define
shack
it.
in the backyard. And the contract says you can't use it for irrigation and you can't use it for animals.
Correct.
But we know there are some people who are ignoring that instruction and they're using that water. And there are just a few who, from the Air Force, have gotten a specialized spigot in the yard to feed their lawn or to feed their animals. So there's no standard answer to what that actually means.
That's true.
Okay, well.
But if you talk to Culligan or EcoWater or those, and you say whole house, they're considering it the house.
Interior.
Interior.
Only.
Yep.
Okay. Second question, has lab testing been done on common produce items? Spinach, basil, and did the Department of Health do a survey and have those results come out?
Yes, the Department of Health did a study of cattle blood, of eggs, and of chickens. They didn't do produce.
No produce.
But there are produce tests that you can Google and find from other places. And there is a big distinction between leafy vegetables and woody vegetables. And there's different parts of different vegetables. And there's a lot of analysis underway about how much uptake there actually is of which different chemical. And it leads us towards my promotion of a meeting in November right here that's all about agriculture. And so we will have some people here on the stage on that night that are able to talk to us about what's the latest in questions like that.
And again, one other thing about plants is that it may only go into the leafy parts, but the piece that you eat is fine. So
well, there's lots of root crops too, right? Okay. Are those references linked on the West Plains Water Coalition site for food products that are PFAS impacted?
Yes, I can't say that we're totally up to date on that, but we're trying to do our best to always put out the latest news. And it's an example of how any of you could help us as a volunteer, because there's so much information out there to try to keep up with. And someone who would like to put their hand up and do some of that interpretation and research with us would be an important part of the team. Thank you in advance for getting involved.
Okay. Now, one last question. A tremendous effort on the part of this health committee. I have to continue to wonder, where is our Spokane Regional Health District and why have they not declared a health crisis for the West Plains, the entire West Plains? We have the Amber Waldruff, County Commissioner for not our district, but she is now the lead on the Spokane Regional Health District Board. Has she been tapped for this? We've been in front of her numerous times at the commission meetings.
She and I have talked about this. I volunteered to come and give a talk to the board of the Regional Health District when the time was right. She said, that's a good idea. I'll let you know.
I would encourage encouraging that, because this is a health crisis. There are more than 4,000 wells out here. 57% of them on the east side of Hayford Road are contaminated to a serious degree.
That have been tested. There's so many wells that still have not been tested yet as well. So that percentage could be much higher.
And we also know that the health district is working on the question, now I have a used PFAS filter that's full of poison, what do I do with it?
Right.
And Bree just said tonight that Ecology is working with the regional health district on the answer to that question and the educational promotion then that will help us know what to do safely with used PFAS filters. Thank you, Bree.
Does anybody know how to wake up the Spokane Regional Health District? We've been, since 2017, when Al French was on the board of the Regional Health District, that's when the airport and the airport board, including Mr. French, learned that they had PFAS in every single doggone monitoring well that they sampled, and they didn't sample all, and they had PFAS 5,600 parts per trillion. So where is the health district? And could we begin to call them and say, hey, we've got a health crisis out here and you need to step in and step up?
Well, let me skip ahead to my script. Brandon, if you can pull up the next slide. On April the 14th, our very next public meeting is at the Unitarian Church, which is down by the river. And the topic of this night is PFAS in the Spokane River. Dr. Pritchard's first surface water testing, and there's a big poster in the lobby of Medical Lake, Willow Lake, Deep Creek, Hangman Creek. Now Chad Pritchard has data on small amounts of PFAS far and wide, and you know how far downhill it is from here to the river. So the guest speakers on this presentation, April 14th at the Unitarian Church, are Chad Pritchard kicking off the evening with results about surface water, including the river, with a PFAS engineer named Fred Kirshner, who has done Superfund work for tribes all around the country. The riverkeeper, Jewel Schultz, is going to talk about surface water, and the riverkeeper nationally has done some PFAS testing in rivers around the country. We're going to hear a little bit about that. Marlene Feist is going to speak representing the city of Spokane. She's the Public Works Director. She said to me about the West Plains, yes, there's a dotted line on the map, but we don't think like that about us and you. We're all in this together. And that was very encouraging to me. So she's going to talk. And a columnist from the Spokesman Review named Amy Midstock is going to do an essay about what the water means. So I think this feeds Julia's question of, is the city going to respond? Is the health district going to wake up? This is the sort of event that we think will push the question forward. And we started on the West Plains, but now we know that PFAS is in low levels in many other places throughout the county. So what started about just us is moving towards town, and
Right.
this is sort of a symbolic event.
Right.
I hope you'll come on April 14th. You can share that.
Yeah.
And on our website, you'll always see upcoming events information there, and tune in. And the final public event of the year is on June 9th, and that's Chad Pritchard, a whole evening of him and his students talking about his 2-year summary of an ecology study that tells us a lot about the 3D aspect of the hazard of your well, depending on how deep it is. And Gail referred to the idea that in this survey, the well depths were from 60 to 1,200 feet. 40.
Yeah.
So it's a 3D with pancakes and layer cakes. It's not just when you look at the map where is your hazard on the surface. And it's really complicated. Chad's the guy who knows. He's also gotten some small grants from his university, from EWU, to keep going in the fall down the road towards what else do we need to know that we don't know, because there's a lot left to learn.
Yeah, hello. Is this on? Hi. My name's Tom. I'm your local Culligan man. I've worked with a couple of you here in the office, Scott and Kathy, here today. Basically, I just want to let everyone know, because I don't know how well it's out there, but Culligan has, I can't talk very well. Culligan has in the last couple of months, we've developed a fully certified whole home removal system that is NSF certified for the 2029 standards at 4 parts per trillion. So we are the only one that I know of in the world that has that certification. And we're doing home consultations. We can fix your problem, and we can guarantee it by a third party. And if anybody wants a consultation, I come out to your house, privately. I got flyers here for everyone to grab with my phone number and some information, but NSF certification is what people are looking for when you sell a home or when you buy a home. And Culligan is the only one that can provide that. So if you're interested in any more information, I'd be happy to speak with you individually and see if I can help you guys out. Both.
Hey, Mr. Culligan man, I have a question. I was looking at the RV filters that Culligan puts out, and I don't see any information on your websites about certification for those. So maybe you can influence the company to get the certification for those so that people can use them with their hoses and the
Yeah, I appreciate that, and I will mention that to them. One of the things I just also wanted to bring up was a couple of clients have come to me with the fix that they're given to people for their under the fridge filter, and it literally says right on here, not performance tested but or certified by NSF. So the answer they're giving you is something that hasn't been tested or proven, and we have one that has been rigorously tested and proven. So just if that's helpful to anybody who wants a third-party backing on the equipment, I can definitely help with that.
Thank you.
So, yeah.
Any more questions?
Has the airport been designated at fault yet?
Yes.
They have, for sure.
Yes.
Okay.
And there's a whole website with 2,000 pages of detail. If you want to look it up, just Google Spokane Airport, Washington Ecology, and you can read for days on what's already been discovered.
Isn't that kind of where we wanted to be with them accepting fault? And we can press on?
Well, accepting fault is a good layman way to say it, but I don't know whether their lawyers and Ecology's lawyers would agree that's what was going on. But they were determined right away to be a responsible party. And it didn't take long when the 1,000 pages of public records release was reviewed by Ecology for them to look at the data and say, yeah, this is serious stuff. So that investigation is underway for sure. And there's a lot to read. It's encouraging to me, but it's really slow. There will be public comment opportunities at many stages of this multi-stage investigation, and you can count on the coalition to remind you that it's time to step up and give an opinion about the airport investigation. So stay tuned. I'm going to wrap up this now. As you knew already, there's tremendous variety in how we live and how we use our land. But when we look at PFAS experience, we find commonality, as the survey shows. Here's what this means to me. Many people have already gotten started on their own to protect their health, and hundreds have now been helped by government programs. Evidence also shows that hundreds of West Plains properties have clean drinking water. That's good to know too, and we hope it's reassuring, but PFAS solutions for everyone require community-wide engagement. We can't do this alone. Any health action by one person moves the needle for all of us together. It builds the collective power towards what we need as a community. That's safe water for everybody, plus our animals and pets. And that's the mission of our coalition. The science of PFAS was suppressed for a long time because it was such an effective and profitable chemical ingredient in thousands of products we like. And the government was the biggest customer by far of firefighting foam. If we compare PFAS with tobacco, the 1998 federal settlement required the manufacturers to reimburse states for lung cancer health care and to pay for anti-smoking education. This may happen eventually with PFAS, but not soon. A PFAS policy expert I met at the recent national conference said PFAS may be bigger than tobacco, asbestos, and lead combined. Groundwater PFAS is a West Plains fact since the 1970s. It's only the admission that's new, not the PFAS itself. The uncertainty is not in the science. It's in who's going to clean it up. Filter technology is advancing at a feverish pace. We're trying to keep up on your behalf so that home filters of any type actually produce safe water at the best price. I'm happy to report that there's a new PFAS laboratory in Tacoma offering homeowner tests for $139. So If your water has not been tested, this seems to me like an attractive price. And the man to tell you all about it is Wayne. That's Wayne. Put your hand up. He's got a half-page information sheet that he's glad to hand out. And so say hello to Wayne on your way out tonight. The existing program of free home filters from the Department of Health is still available to any homeowner with a PFAS test from a certified lab like Anatech or EPA. The geographical eligibility has been expanded. It's now serving homes anywhere on the West Plains, but not duplicating the Fairchild program. Qualifying PFAS levels in this program are the latest EPA numbers, 4 parts of PFOA and PFOS, and 10 for PFH excess. If you'd like to get more information about that or enroll, speak with an Ecology staffer here tonight. We have 3. Stand up, please. That's Bree, Jeremy, and Nick. They'll tell you all about the free filters that are available now from DOH. And there are printed copies available of that application online or in the lobby. And to close, I'm very happy to say that our 2-year grant from Washington State Ecology has been renewed. So stay tuned for 2 more years of this through June 2027. Thank you all for coming.
Is this gone now?
No, it's
A couple of tidbits to think about, because we are all going to be saddled by filtration from here on out, pretty much. And I want you to think carefully about who's responsible and who should be reaching into their wallets to pay. The Spokane International Airport, the property is co-owned by the City of Spokane and Spokane County. It's not just the airport, it's all the thousands of acres that surround the airport where their multiple 27-plus monitoring wells exist. So, whatever you've done as far as filtration, do not settle for anything less other than whole house filtration, including your exterior. These are the same filtration shacks or comparable filtration shacks that Fairchild has provided to the tune of about 50 grand a piece. So do not settle for a point of use at your kitchen sink or under your kitchen sink. It's going to be real expensive. It's going to be require maintenance. Filters are not cheap. The canisters, the plumbing, replumbing, it's all very expensive. And keep your eye on the Spokane International Airport. The city owns it. The county owns it. The city owns the waste management plant, another huge pollution source out here on the West Plains. So don't throw up your hands and do not settle for some little weenie thing at your kitchen sink. Folks, thank you.
You're welcome.